Hello, my name is Raymond, and in this video we're going to be talking about ACE inhibitors as a class. First, let's start with patient counseling points. These medications are commonly used to lower blood pressure, treat heart failure, or help your heart after a heart attack. It may be used for other reasons as well. The medication is taken once daily with or without food. Sometimes it may be taken twice daily, so follow your doctor's instructions as directed. If you miss a dose, take it as soon as you remember. However, if it's close to your next dose, skip the missed dose and continue taking the medication at your normal time. Do not take 2 doses at the same time. Do not take this medication if you are pregnant. Some common side effects include a dry cough, dizziness, or headache. Side effects tend to go away as you continue to take the medication. For some people, taking the medication at bedtime may help prevent dizziness and headache. Report to your doctor if you experience these serious side effects, which include swelling of the face or tongue, signs of an allergic reaction, irregular heartbeat, the inability to pass urine, muscle pain or weakness, or a cough that does not go away. Shown here are all the angiotensin converting enzyme inhibitors, simply known as ACE inhibitors. Some of the more common ones seen are going to be benazepril, lisinopril, and ramipril. Notice that all ACE inhibitors end in the suffix pril. ACE inhibitors play their role by affecting the renin-angiotensin-aldosterone system, also known as RAS. As described by its name, it inhibits angiotensin-converting enzyme that is produced in the lungs. What this enzyme does is it converts angiotensin 1 into angiotensin 2. Angiotensin 2 is responsible for increasing blood pressure due to vasoconstriction and stimulating the adrenal cortex to produce more aldosterone. By using an ACE inhibitor, we're going to lower concentrations of angiotensin 2 and thereby reduce vasoconstriction and lower blood pressure. By lowering aldosterone production, this is going to increase sodium excretion, which is then going to decrease vascular volume and help lower blood pressure as well. ACE inhibitors also prevent the breakdown of bradykinin. Bradykinin helps stimulate vasodilation, however it is also associated with side effects such as angioedema and cough. ACE inhibitors are indicated for the treatment of hypertension, heart failure, acute coronary syndrome such as myocardial infarction, patients with diabetes mellitus with albuminuria, and proteinuria chronic kidney disease. Shown here are the more common ACE inhibitors with the more common indications. First, note that the initial dosing for hypertension tends to be higher when compared to those in heart failure and acute coronary syndromes. Doses do need to be titrated upwards to either reach an effective dose, a tolerated dose, or the targeted dose. ACE inhibitors do need to be renally dose adjusted in patients with a creatinine clearance below 30. We want to use an initial dose at the lowest possible dose. We then can titrate them upwards to the normal maximum dose seen outside of renal impairment. An exception to this is ramipril. Note that ramipril has to be dose adjusted for patients with a creatinine clearance below 40, and it's recommended to only use 25% of the normal dose. Typically, ACE inhibitors are dosed for once daily, however they can be split and divided into 2 separate doses when needed. ACE inhibitors have a black box warning of fetal toxicity. Drugs that act directly on the renin-angiotensin system can cause injury and death to the developing fetus. Discontinue when pregnancy is detected. Other warnings include angioedema, hyperkalemia, hypotension, renal impairment, cholestatic jaundice, and avoid use in patients with bilateral renal artery stenosis. Contraindications to use include hypersensitivity, patients with a history of angioedema, use of aliskiren in diabetic patients, and use within 36 hours of a neprilysin inhibitor such as Entresto. Here are some clinical pearls with ACE inhibitors. They're commonly manufactured in combination with a thiazide diuretic or a calcium channel blocker. such as lisinopril and hydrochlorothiazide, or benazepril with amlodipine. These may be beneficial in patients with poor adherence, as it may reduce their pill burden. ACE inhibitors do not work as well in lowering blood pressure in Black patients. So if we're only using it for hypertension only with no other comorbidities, it's best to use a different agent instead. Drug interactions include: avoid using with an angiotensin receptor blocker such as losartan, or a renin inhibitor due to increased risk of hyperkalemia. ACE inhibitors also decrease lithium clearance and may increase the risk of lithium toxicity. Some adverse effects include dry cough, hypotension, hyperkalemia, headache, dizziness, fatigue, and an increase in serum creatinine. Patients on ACE inhibitors should be monitored for blood pressure to show efficacy and to ensure that they are not hypotensive, serum creatinine to monitor renal function, and serum potassium, as you don't want patients to become hyperkalemic.